What's up, guys? Before we get into it, here's a quick word from our sponsors.
Is ADHD keeping you from getting things done? Are you looking for something to help aid you in staying focused? As a part of a treatment plan, my doctor prescribed me Vyvanse. It's not going to do my work for me, but it sure does help. Vyvanse helps me control my ADHD, but I do the rest.
Side effects may include vomiting, anxiety, dizziness, xerostomia, weight loss, decreased appetite, diarrhea, stomach pain, insomnia, irritability, headache, allergic reaction, chest pain, hallucination, high blood pressure, tachycardia, paranoia, shortness of breath, aggression, cardiovascular disease, fatigue, mood changes, delusions, and depression.
Ask your doctor today about Vyvanse.
Howdy, and welcome back to In Your Head. Today we're tackling the medical model of psychological stress. Is it a life-saving framework, or does it oversimplify the complexities of mental health? Let's dive in. Today with me are Gio, Kelsey, Reese, and Quinn. Gio, let's get started with you. What's the role of neurotransmitters like dopamine in the medical model, especially for ADHD?
So that's a great question. Dopamine and norepinephrine are huge in ADHD. They regulate attention, motivation, and impulse control. But in ADHD specifically, their systems are dysregulated. And that's why stimulant medications like Adderall or Vyvanse are often prescribed when treating ADHD, as they increase the availability of these neurotransmitters. And the overall idea is to help the brain function better in areas controlling focus and behavior.
Okay, but here's my concern. These medications are just one methyl group away from being meth. Like, how is that okay? I've seen how addictive and life-altering meth can be. Are we just making deeper problems with these treatments?
You're not wrong. I actually tried Vyvanse once for ADHD symptoms, and I had very negative side effects. Almost every negative side effect in the book, like insomnia, anxiety, no appetite. It completely changed me, and I decided that it just wasn't worth it. But here's the thing, not everyone reacts the same. For some people, meds are life-changing and in a good way.
Yeah, that's right. And that's where I think the medical model can fail a lot of people. Its goal is to diagnose, treat, and prevent, but it's definitely not perfect. And a lot of times overdiagnosis of ADHD, for example, can lead to people taking medications they don't need. And for those who genuinely need help, the focus can get stuck on medication instead of like therapy and other lifestyle changes they might need.
Yeah, I completely agree, but I think it's super important not to forget about the benefits. Gio, you mentioned earlier how these treatments can help regulate focus and behavior. How do you think family and friends can support those who endure ADHD symptoms? And how do you think they can help influence their treatment?
They play a huge role, actually. Families can create routines, reduce distractions, and help with reminders for medication. But emotional support is just as important, as celebrating progress and being patient when things are tough can make a huge difference.
To add to that, friends and family need to remember that medication isn't just like magic, it's a tool. And someone with ADHD still faces challenges and needs understanding and not full-on judgment.
Yeah, that's fair, but it circles back to my issue. Are we too reliant on medication? Doesn't the medical model sometimes ignore systematic or cultural influences? For example, ADHD behaviors might just reflect a mismatch between our fast-paced world and how some people naturally process information.
Exactly. The medical model often treats mental health issues like they're purely biological, but culture, childhood, and even educational system play huge roles. If we're not addressing these influences, we're missing the bigger picture here.
Are y'all thinking that we should move beyond the medical model, or we should stay within the bounds of medical model?
Not necessarily move beyond it, but we should expand it, of course. We can combine biological treatments with therapy, social interventions, and lifestyle changes, since it's about treating the person as a whole, not just the symptoms.
I agree. The medical model is a good starting point, but we need to recognize its limitations. It's not one size fits all, and that's okay.
Exactly. Let's use it as a tool and not the entire toolbox.
And let's not forget the importance of critical thinking. Question the diagnosis, the treatments, and the systems that influence them. Mental health is complex, and we need complex solutions.
Look, guys, I love it. And to wrap things up, it's important to remember that mental health isn't an easy answer. There's no one solution. It's important that if we use the medical model, we need a balanced and holistic approach. We need a little Sigmund Freud in our minds, a little psychoanalytical analysis. We are more than just a diagnosis. We are a person, and we have experiences and different lifestyles. And we can't just put one answer to solve all of our problems. Hey, look, thanks for listening to In Your Head. Stay curious, stay critical, and take care of yourselves. Bye.
Thank you for watching. Bye.
Hey.